The TransCu is a unique and non-invasive low-dose tissue oxygenation system, which when applied in conjunction with appropriate dressings, provides a moist wound environment for the continuous treatment of difficult-to-heal wounds, such as venous leg ulcers, diabetic foot ulcers, and pressure ulcers. This new therapy, known as TransCu Continuous Diffusion of Oxygen, or CDO therapy, is an adjunctive therapy to feed an oxygen-compromised wound a continuous supply of supplemental low-dose pure oxygen directly to the wound bed. The TransCu device is lightweight, battery-powered, and portable, weighing only 9 ounces, and small enough to be worn discreetly using the supplied fanny pack. No external oxygen supply is needed. The device generates pure oxygen electrochemically from the surrounding air using fuel cell technology. Features include sensors for oxygen flow and pressure, which constantly monitor the oxygen flow rate and thus ensure delivery of therapeutic oxygen to the wound site. The TransCu has been cleared by the FDA for treating the following wound types: skin ulcerations due to diabetes, venous stasis, post-surgical infections, gangrenous lesions, pressure ulcers, infected residual limbs, skin grafts, frostbite, burns. TransCu is contraindicated for wounds with inadequate perfusion to support healing, ulcers due to acute thrombophlebitis, ulcers due to Raynaud's disease, necrotic wounds covered with a char or slough, wounds with fistula, deep sinus tracts with unknown depth. Before applying the device, gather the appropriate supplies. Supplies needed for application of TransCu TransCu device, TransCu wound site oxygen delivery cannulas, TransCu oxygen delivery extension set, optional, cleansing solution, normal saline, wound cleanser, etc., per institution's policy. Dressings, foam, hydrogel, hydrofiber, calcium alginate, etc., depending on evaluation of wound. Skin protectant barrier wipe if necessary. Gloves and other protective equipment per institution's policy. Transparent film dressing. Wash hands thoroughly and follow universal precautions. The frequency of dressing changes will depend on the patient's condition and the amount of exudate. Follow manufacturer's guidelines for dressing application and instructions for use. Turn the device on using the power switch located on the top of the TransCu device. The device will light up fully and sound an alarm as it initiates a self-check. The device will then begin a self-calibration process, which takes approximately 2 minutes, during which the LCD screen will display CA. Upon completion of the self-calibration, the oxygen flow rate will be displayed on the LCD screen. The flow rate for therapy is to be determined by the healthcare provider and should be set prior to delivery. There are measures to prevent the patient from changing the oxygen flow rate. The device continuously monitors and makes adjustments to the oxygen flow rate to accommodate environmental variances. The LCD screen will display the corresponding changes in the actual oxygen flow rate. The green System OK LED, located just below the LCD display, indicates the system is working properly when it is lit. Before applying the TransCu, the wound needs to be prepared. Remove and discard the previous dressing per institutional policy. Debride necrotic, non-viable tissue as prescribed per physician if necessary. Removing non-viable tissue will increase the efficacy of the CDO therapy. Perform thorough wound and peri-wound area cleansing per healthcare provider or institutional protocol prior to each dressing application. Dry the skin around the wound by gently patting with gauze. Ensure adequate homeostasis has been achieved. Assess and evaluate the wound and peri-wound. Assess and evaluate for signs of healing, such as increased redness, pain, swelling, or heat within or around the wound, and obtain measurements as indicated per institution's policy. The healthcare provider should be notified if the wound worsens. Report any increased redness, pain, swelling, or heat on or around the wound. Apply a skin protectant barrier wipe to the peri-wound area if necessary to protect the skin around the wound. Avoid maceration and improve adhesion of transparent film. Note that an initial increase in exudate may occur upon application of the TransCu device. Protect vessels, tendons, organs, and nerves by covering them with a fine mesh non-adherent layer, such as wound veil, Mepitel, etc. Do not use any products that are petroleum-based, as this will significantly decrease the efficacy of the continuous diffusion of oxygen therapy. Place the TransCu wound site oxygen delivery cannula in the middle of the wound margins, resting directly on top of a clean wound bed. Direct the cannula out of the wound bed towards the TransCu device. Secure the cannula to intact skin around the wound with surgical tape or steri strips aid in keeping the tubing in place. Tuck the tape in around the tubing to intact skin. The cannula and wound site is then covered with a moisture-absorbent dressing. The type of dressing is based on wound exudate and etiology. Position the moisture-absorbent dressing to cover the open end of the wound site oxygen delivery cannula and the entire wound bed. Follow the dressing manufacturer's instructions for use. It is important to inspect the dressing site regularly and change the dressing according to dressing manufacturer's instructions for use. Apply a thin film dressing to cover the moisture-absorbent dressing, cannula, wound site, and perimeter of intact skin around the wound site. Tuck the thin film dressing in around the tubing to intact skin in order to reduce oxygen leakage. Follow the dressing manufacturer's instructions for use. The film dressing traps the oxygen in the wound bed, creating an oxygen-rich environment to aid in wound healing. Gaps or tears could allow oxygen to leak out from the dressing and potentially lower the oxygen concentration at the wound site, which could affect the efficacy of the therapy. Inspect the dressing regularly and change the dressing according to the dressing manufacturer's instructions for use. Optionally, an oxygen delivery extension set can be connected to the wound site oxygen delivery cannula by inserting the male luer fitting of the oxygen delivery extension set to the female luer fitting of the wound site oxygen delivery cannula and firmly turning clockwise to ensure a solid airtight connection. Direct the wound site oxygen delivery cannula and optional oxygen delivery extension set away from the wound site towards the TransCu device. Secure the tubing with surgical tape as necessary. Allow slack in the tubing path for freedom of movement and ensure that the tubing is not bent in a way that could restrict the flow of oxygen. Connect the female luer lock end to the wound site oxygen delivery cannula or optional oxygen delivery extension set to the male oxygen delivery port labeled O2, located on the top of the TransCu device next to the power switch. Firmly turn the luer lock clockwise to ensure a solid airtight connection between the oxygen delivery port and the cannula or extension set. The TransCu device is now delivering continuous diffusion of oxygen therapy to the wound. Always leave the TransCu device turned on. It is intended for continuous delivery of oxygen to the wound 24 hours per day, 7 days a week. It is not necessary to turn the TransCu device off. Only turn the TransCu device off if you will not be receiving therapy for an extended period, or when requested to do so in case of troubleshooting. Refer to the patient handbook, or contact your local wound care supplier for additional questions about TransCu. If you have immediate medical questions or concerns, please call your healthcare provider.